Hello everyone, you're watching Physio Classroom channel, and in this video I'm going to share with you one of my favorite exercise and maneuver that I often use to treat patients who come to the physiotherapy OPD with chief complaint of occipital headaches and upper cervical pain. Now, in such patients, it is often the suboccipital extensors which are at fault, which causes the jamming or the restriction in the first two cervical vertebrae, and as a result, we see that such patients develop chronic upper cervical pains and they often complain that the back of the head is hurting. So a simple maneuver that can be used on a daily basis to provide magical relief is to just ask the patient to lie down in the supine lying position and then just bring the chin towards the sternum in the maximum nodding position and try to look down towards the feet and hold this position for around 15 seconds. Now, for some patients, it is not going to be an easy task because this requires activation of the deep cervical flexor muscles. Now, if required, we can also give assistance or support at the back of the head. Once the patient has completed this 15-second maneuver, we will let the patient come back to the neutral position, and again after 15-second rest, we will ask the patient to again take the chin towards the sternum in the maximum nodding position. But this time we will also produce slight lateral tilt and hold the position for another 8 to 10 seconds. And the same maneuver will be continued by tilting the head to the other side for around 5 degrees and holding it for another 8 to 10 seconds. And then patient is again going to relax to the neutral position. And in the third and final step, we will ask the client to again take the head up in the maximum nodding position and then try to look as far to the right as possible without moving the head and hold that gaze for 15 seconds and then look as far as possible to the left and hold that gaze for another 15 seconds while the therapist is providing assistance to the back of the head. If we perform this maneuver on a daily basis, we are going to see magical relief in symptoms of occipital headache and upper cervical neck pain. Do try this in your patients and let us know your valuable feedback. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.